Imperial NHS Trust's board minutes, and they do as one does, and they were doing a sort of risk assessment of their business. And one of the things that one of the directors said was, we've forgotten to put in the Brompton Hospital and the Marsden Hospital as competitive risks. They are a threat to our business, and, you know, in purely business terms, that may well be true, but isn't it sad when our leading heart and cancer hospitals actually have to be seen as competitive in that way? Enough from me, because there's lots more hands up. Jos.
Hi. Hello, love. Have I got this? There we go. Hello, Sandra. Hello, Louise. Lewisham, like Louise has. I am working with various campaigns across London, and you know, it's nice to be back here and see you continue to fight the fight. Lots of issues coming up. I absolutely agree with what Louise said. You know, in terms of competition, I have been a patient stuck in between 2 or 3 hospitals, each kind of falling out with each other over my case. So I'm sitting there wondering what on earth, and the team's not liaising with each other, and that is because each team wanted to be the one who seemed to be in the know, and I got nowhere. And in the end, you know, that finally got resolved, but it's not a good, efficient use of medical time. And in fact, in 2010, our NHS was deemed in in the Commonwealth criteria to be the most efficient NHS, to be the most efficient health service in the world. So, you know, and we're not now, unfortunately, and, you know, that is about, you know, a deliberate attack on our NHS through really driving through the Health and Social Care Act, absolute rampant privatisation, and, you know, we need to have a government who will overturn that. Can I just say, in terms of risk, I think you're at a place where I've been, I am involved with the Save Earls Court campaign just down the road, and the 77-acre project that Hammersmith and Fulham Council and Kensington and Chelsea Council are trying to push through as much of it as they can before the local elections, to basically demolish the Earls Court sites, dig up the Lily Bridge underground depot and flatten 2 perfectly decent housing estates, and just give it over to high-rise block developers who are already marketing the properties that are still not architecturally designed in the way you would expect, marketing them abroad in Hong Kong and whatnot. This is part of, you are a community. West London is a community under attack, and that, you know, we've been under attack in Lewisham with respect to our hospital, and, you know, the NHS is under attack, but as a community, West London, and I've done lots of work with regeneration programmes over the years, this is not regeneration, this is destruction.
Yes.
And I've just completed a risk assessment for the Earls Court and West Kent opportunity area, so-called, and that's gone up online this week. We launched it in the Commons with Andy Slaughter on Tuesday night. I just think you need something similar to be ready for July and pull together your absolute knowledge of what the risks are to breaking up your hospital system over here, and obviously particularly for you, Charing Cross. I did speak to Bruce Keogh, so Bruce, a couple of weeks after your meeting here when Mark Spencer dropped his planner about if you were on a bus, you should not be going to A&E, you should just be going to a pharmacy. So I flagged that up with Bruce, and in a question, then we had a chat about it afterwards. He was obviously not impressed with Dr. Spencer's comment, and he said he understood that some people would have to get a bus to go to A&E, and that the only other option is, the only way you go to A&E is in an ambulance. Well, you know, we know what's happening to the ambulance services. And in terms of travel time, I've met somebody who's doing some analysis of what's being used is distance, isn't it? It isn't about traffic density. It isn't about congestion or density of population mass. This is just a very crude measure, and it's been it was developed, invented, whatever word you want to use, by an academic in Sheffield, who is now saying, whoops, might have got that wrong, and he's looking for funding to try and redo his study. So he's looking actually at the differentials between rural areas, urban areas, high density urban areas, you know, landmass stuff. And I think we need to tap into that. And I'm sorry, it's, you know, because this is really, you know, I don't know anybody else in London who's been in touch with this person. So I think I've just got some ideas that you could put in a risk assessment. Okay.
Yeah, that's great.